This is Dr. Nick Walters from Mission Hospital, Bangkok, and I'd like to talk to you today about traveler's diarrhea. It's a very common problem. In fact, it's estimated that up to 50% of travelers will have traveler's diarrhea during their travels. Because of this, it's an important subject to you and me. Traveler's diarrhea is diarrhea occurring while a person is traveling. The most common source of diarrhea is a bacterial infection. Usually presents with just diarrhea, but sometimes quite voluminous to the point where the person can become dehydrated. Sometimes there can be other more severe forms of infection in the intestine, including blood or mucus in the stool or having fever. Now, with traveler's diarrhea, the majority of cases can be managed by themselves. You can take care of it yourself without having to see a physician. The best way of treating traveler's diarrhea yourself is for you to stay hydrated. If you can bring with you some oral rehydration salts, which are sold very commonly here in Asia in most pharmacies in a packet, which is basically a collection of sodium, potassium, some sugar, all mixed together in a powder. You add this to some water and drink it. You use this in place of just plain water when you're having diarrhea. Doing this will prevent you from depleting your body too much of these blood salts, because if you have a depletion of these, you'll feel very weak and you may need to be treated in the hospital. So when should you see a doctor if you've got traveler's diarrhea? Well, if you have blood or mucus in the stool, or have a fever with your diarrhea, or if the diarrhea persists for more than 3 days, you really should see a physician. Antibiotics are not necessary usually, except in cases where there is blood or mucus or fever. In those cases, that often means there's an invasive type of diarrhea. Here in Asia, the most common causes include E. coli, Salmonella, Shigella, Campylobacter. Sometimes amoeba and Giardia can also cause similar symptoms. So if you think you have one of these symptoms, not just the loose stool, but you have the blood or mucus in the stool or fever, you need to see your physician. Now, as far as prevention, the best way of preventing traveler's diarrhea is by eating and drinking food and water or fluids that are clean. That means if it's fruit, make sure it's a fruit that you peel yourself or you see it peeled in front of you. If someone else has peeled it, or it's a fruit that hasn't been peeled, then it's better to forget it. If it's food, make sure that the food is cooked and is hot when it's served. If you buy your food from a stand at the side of the street, you're more likely to develop traveler's diarrhea, but you can reduce your chances of getting traveler's diarrhea by having them cook the food thoroughly in front of you while you wait. And most vendors will be happy to do this. The main thing to remember is staying hydrated. If you have decreased amount of urination or the urine is yellow, you're feeling very weak, you need to see your doctor right away. This is Nick Walters, hoping that you travel well.